Hello and welcome to the Surgical Spirit podcast. I'm your host, Dr. Haidar Al-Hakim, the Third Eye Doctor. Pull up a chair and get ready for some candid and uncompromising discussion with experts, innovators, agitators, and influential people from every corner of health and well-being. From inside the hospital to at home in the kitchen, we're leaving no stone unturned in our quest to uncover the secrets of healthier, happier, more successful, and less stressful lives. Thank you so much for joining us, and without further ado, let's meet this episode's guest. Hello, Paul. How are you?
Hi, Haidar. I'm very well, thank you. I'm very well.
Good. Now, your podcast,
Yes.
A Doctor's View.
Yes.
Why?
Why A Doctor's View?
Well, why doing the podcast?
It's an interesting one. Do you know, I had a lot of thoughts in my mind that I wanted to share, and I found myself sharing it with sharing ideas with people who actually weren't that interested in hearing them, and and I could see by their facial expression I had strong opinions on certain things, and I'd try and find a way to almost engineer a conversation so that I could share this opinion, and I'd look at their facial expression and be like, yeah, they're not that interested. I thought, I wonder if some people are interested in this. And I thought, oh well, you know, I always wanted to do something like YouTube or something along that line, but I was always a little bit insecure in a way to do a whole YouTube thing. Getting better at that, but I thought, what about voice only? And I thought that could be fun.
So what kind of strong opinions you had that you felt frustrated enough to start a podcast?
There was a few. It reflected a lot in my early ones. So things like the anti-vax movement campaign. I'd see articles on them, and they would annoy me. They would frustrate me. And also, I had one on the the healthier any size movement. There's a HAS movement, as it's called. And
What's that about?
So that's about this idea that you can be morbidly obese and healthy, and it's led by people that are very, very overweight, and they have this narrative whereby they're completely healthy and there's nothing wrong, and that everyone else has the problem. And now my view was, no one's got for a personal point of view, no one's saying that you shouldn't love yourself or you shouldn't think you're beautiful or anything like this. Nothing to do with an appearance perspective. That's fine. Just don't try and sell the narrative to others that you can be morbidly obese and healthy. And they're saying, I don't have any, I'm not taking any tablets, I'm not doing this. It's like you're not yet. You know, you might not have diabetes.
Well, maybe
yet.
they are, but they're not. You know, they're not being
honest.
Honest.
Yeah.
Because people who are morbidly obese, I mean, when I get 20 pounds heavier than my normal, I feel pretty shit.
Yeah.
My joints fucked up. My liver's, I'm not totally jaundiced, but I'm thinking, this isn't good.
Yeah, absolutely. And I think that the final straw was when Cosmo, the magazine Cosmopolitan, when they put a morbidly obese lady, I keep forgetting her name, on the front cover of Cosmopolitan, sort of saying, "Oh, big is beautiful," and I'm thinking you shouldn't be endorsing this culture of overeating and this, that, and the other. It's like in the same way that if you put someone anorexic on the front cover, it's the same thing. You shouldn't do that either. Put someone of a normal BMI, normal size on the front cover. Then I'd applaud you for it. But don't go to this extreme because it's seen as a culturally or politically correct thing to do. I think that's actually just, to me, a cop out, and I think it's actually quite dangerous. And so I had views on things like that, um,
What
and
were
also
people's reactions? I mean, were they just sort of too busy with their lives, or they felt that normal is just boring?
what were people's reactions to the podcast, or
No,
so?
no, to you sort of having these, you want to talk about these things, but they're just not interested.
Yeah, I
Or they
think
don't agree with you, or do they just don't want to be unpolitically correct?
they would they'd actually, the ones that were interested were actually, yeah, you've actually got a point there, and a lot of people did agree, and others like, oh, you're being a bit harsh, and I'm thinking, no, I don't think I am actually, because um you wouldn't be saying that I'm harsh if it was on smoking or on
Mm,
alcohol or on drug use. Yet, it's our biggest killer now.
mm.
So why am I being a bit harsh? It's because it goes. We're living in a world where political correctness is engulfing our lives, and it's stopping
Yeah,
us from expressing ourselves, perhaps, or being too scared to say the right thing, even if what we're saying is there's nothing actually wrong with it. And you can't. It's always fine to have to accept being offended, but it's never okay to offend. I think that seems to be the narrative that we seem to have, and
mm.
it annoys me a little bit.
Yeah. I mean, I love to offend. I mean, I absolutely love it, and
Yes.
um, but yeah, it's not fair. I mean, particularly the anti-vaxxers. I mean, even doctors now are changing their views about vaccines.
Yeah.
Proper trained
Yeah.
doctors who've been in the game for a long time, but because the propaganda is so strong.
The propaganda is massive, Haidar. I mean, when I was researching that podcast, the anti-vax podcast, I mean, this was actually, more than anything, this one, I think I come across that when I'm speaking in that podcast. It's the one thing that frustrates me the most, because I've met relatively, we're talking about intelligent human
Yeah,
beings,
yeah, yeah, yeah,
who
yeah,
have been sold this idea, and were running with it, and telling me, no, you're wrong about vaccines. I've read this. I've done. It's like, no, just no. And I break down the sort of evidence base in it, and I go through that original paper, talk about that original paper by Andrew Wakefield, and sort of just talk about how rubbish it was. I think it was a study of 12 people, something like that.
yeah, yeah,
And it boggles the mind how the tabloid style press
yeah,
headline can have such a big impact. And that's actually what I've been trying to do since, is try and debunk some of the things. So even, I think it was a couple of weeks ago, or last week, I did one on like fizzy drinks and health. That was a big topic, and just trying to go through that headline and just go, okay, just take a step back. And if you read the article, it's not as clear cut as you might think. And that's what I've tried to build the podcast on. And then in the interim, just meet some fascinating people, as like yourself, and met some incredible people who've shared some incredible stories, and it's been lovely, and they've been very well received. So um,
yeah. I mean, it's a problem, that you got so much pseudoscience out there,
yeah,
and you just need a handful of so-called experts, i.e., they've done a bit of training, they've done a few courses, they've got a doctor in front of their name, and they've got a few other letters after them.
yeah,
And it is quite easy to sort of jump on that bandwagon and give it a lot of credibility and status.
yeah, very easily.
And the majority of people don't understand these things.
No, and all it
Yeah,
takes is to say something convincingly. If you and this was actually something that I learned in med school, in the OSCEs, our practical exams, if you had this idea that you didn't know what the answer was, but you stood up and and you said something with conviction,
Yeah, and
it made
power.
it empower and said, no, yeah, this is, you could create a syndrome. I think there was a bit of a joke. There was a guy, his surname was Pang, and we thought, if you stand up and said, I've no idea what this is, but you think, yeah, this is Pang syndrome, and you gave a triad of all the symptoms of Pang syndrome, that the examiners would be like, you know, what's that, and there's this element of if you say something in the right way, you can actually convince a lot of people to do very, very silly things.
You got to get your voice out there.
Mm.
And but there's, I think, 700,000 podcasts now.
Yeah, it's growing.
Something really crazy.
Mm.
But at least it's your kind of voice getting out there.
Yeah, it's
And,
nice.
particularly an intelligent voice, and someone with reason, and someone who's open to taking criticism, suggestions, dialogue. And I think that's really important. And from that, people understand that there is scope for having a difference of opinion. I think
Yeah,
that's important.
yeah,
And if we agree to disagree, and that's fine as well.
yeah, absolutely.
At least we know where you stand and where I stand, and then we can move forward. But the problem arises is when it does affect other people's health and well-being. And I mean, mental health is big now because
Yeah.
it's sort of become a big buzzword.
Yes.
And there are lots of people out there who now help, particularly men's health now. That's a big one now, isn't it? Everyone's a sort of a men's health coach or a mental health coach for men only, which is, yeah, I mean, men are pretty fucked up, really.
It's
We're a complicated bunch.
it's interesting, actually, isn't it? The different psyches sort of between men and women in terms of how it's perceived, to even the point where, like you say, we're doing there's coaches just for men now, and I'd love to see what the difference between how they speak to the male patients as opposed to the female patients. It'd be interesting to see the difference in dynamics of a fly on a wall kind of meeting for that,
I
actually.
don't think they'll let you in, Paul. I think it's sort of
I know.
trade secret.
I know.
It's like, no, sorry, and I mean, I'm part of a few men's health groups, and what I'm finding is that they just regurgitate ancient wisdoms, essentially.
Fair enough.
Whether it's from Buddha, or whether it's from Lao Tzu, or whether it's from Martin Luther King, and they just kind of regurgitate what they're talking
No,
about.
fair enough.
I mean, what would your advice be to sort of someone who needs help? You have
Yeah.
I would say, a fairly skeptic mind, that you want evidence,
Yeah.
and you're quite analytical as well.
Yeah.
So what would your 3 top tips be for sort of someone who needs help from a practitioner or advice? I know it's very generic,
Yeah.
but what are your kind of prerequisites that you go to say, look, let's see if this is legit?
So in terms of going from working in a hospital environment, so I would say 3 things from being in a hospital environment. I would suggest 1, talk to someone, anyone. I think firstly, this is and this is goes without saying, you have to speak to someone who, hopefully, in a position where they can do something, be it your supervisor, be it a colleague. You can't just live in silence. 2, let your family know. I think they're the second people. And 3, I would seek advice from your general practitioner, or if you're part of a group like the BMA, they've got fantastic resources. They're the 3 groups of people that I would personally approach. Now, in terms of the prerequisites for if you want to go beyond that and go to see a coach or someone who deals with this type of thing professionally. What the
supposedly professionally.
Yeah, fair enough. But yeah, you found someone you think, okay, I've spoken to these people. I've let my doctor know. I've let my bosses know, my colleagues. I've let my family, friends know that things aren't going quite to plan at the moment. And now I want to seek some third party perspective from someone I've never met. What would the prerequisites be for that? I would say someone who doesn't promise, like you said, a 6-week plan, because you can't engineer someone's mindset to suddenly adjust in 6 weeks or 4 weeks or whatever it is. I think anything like that, it just doesn't work. That could be, to me, false hope. So that's one. Two, I would say someone who has got experience in that field and isn't just I use the word just for want of a better phrase, but doesn't focus mainly on other things. So for example, someone that deals mainly in relationship advice or something like that, and then goes, oh, I can also help you with with your work stresses and things like that. It's like you're seeing 90% of your clients are coming in with this, and you're going to help me with that. You may well be able to, but I think someone that's focuses and specializes on workplace stress and burnout and all these other things that are associated with the working environment. That would be my second thing. And thirdly, I like, again, this is a personal thing, but I like people who don't just wait for you to have an epiphany, and by that I mean they're people who sit and just listen to you and tell you very little, and they'll make you go through things and, yeah, how did that make you feel, and this, that, and the, that's fine. I like people who will say to me straight, do you know what? No, you're being stupid now, or actually give you sound advice, and aren't afraid to offend you. And the majority of people in that profession don't aren't afraid of doing that, but they actually give you feedback and give you advice, rather than wait for you to listen to that advice. And it's different for everyone. Some people prefer to just talk until they realize it themselves.
I agree with you, because something that frustrates me in the coaching sphere is this thing that, the person has the answer. So, if you just sit there and listen, and by magic, they'll find the answer themselves.
Yeah, and that might be the case, but it can take 2 months for that to happen, of a weekly thing or whatever, whereas actually I've met sorry, Karen.
Yeah, I was going to say that the other thing that sort of gets me on my tits is this thing about, I'm going to serve you powerfully. And I'm thinking, what the fuck does that mean? I'm here to serve you powerfully. That really gets on my tits.
I've never where I haven't come across that one, actually.
That's because you haven't been in the coaching sphere for
no, not at all.
So many charlatans, so many bullshit people out there. I guess you've got to just go there and see what it's all about, really. Actually, don't go there, because they'll sell you all kinds of shite.
I can imagine.
I got approached by one guy. Oh, yeah, LinkedIn is really buzzing, and it's great. Could you send me a recommendation, because it'll do wonders to my... And I'm like, right. Well, yeah, you send me one too as well. I went to a sales course, and he wrote a message back saying, no, you do it first. You send me a recommendation first. But as you said, it's very convincing. I mean, he spent 6 to 9 months sending daily messages about how his sales course is absolutely awesome.
Yeah.
And, how you get all these thousands and thousands of, potential clients.
Yeah.
And, it sort of gets you into that kind of hypnotic trance.
Mm.
I said, great. So, I had all these expectations and so on. And I went to the course, and
Yeah.
I was there for 3 days, and I was like scratching my head, and I thought, this is 3 days of BS.
Yeah.
And I did spend a lot of money on it, and I thought, and then I went and sort of talked to other people. But it's weird. It's probably all that sort of expectation, isn't it? That sort of unmanaged and unprocessed expectation, and we get carried away.
Yeah, because I think you almost I mean, there's been times where we've all been in stressed, and when you're going to someone for help and advice, because you're almost at a lost end. You've reached the end of I don't know what to do, and you have this hope that you're gonna go meet this person and talk to them, and all of a sudden everything's gonna become magically better in an hour, and you go there with almost such excitement that something's gonna cause this change, and often that's not the case. Things don't change in an hour, and you're met with a little bit of disappointment. And I think when you've
A lot of disappointment in many cases.
yeah, it's true. And when you then go home and then reflect on it, and you've realized that actually this person hasn't they're not even on the right track, or they're just I've just been talking for an hour and a bit, and they haven't told me anything. That makes it even worse. When you go home and you do get that disappointment, you think, oh yeah, okay, I haven't fixed the problem yet, but yeah, they're onto something. I'm going to go meet them again. That to me, I think that's the sign of a good good coach.
Have you done Jordan Peterson's Know Yourself personality testing?
No, I haven't done that. No.
Yeah. So I did that the other day, and it was quite revealing. And apparently I'm very, very volatile. I have a very, very volatile, narcissistic, not narcissistic, neurotic.
Really?
So apparently, yeah. So, for him, the concept of neurosis is to do with volatility and withdrawal. So those are the two main subsets of being a neurotic. And my withdrawal is okay. It's sort of 50%. That's not too bad. But apparently I'm very, very volatile, like 91st percentile.
Oh,
Being
wow.
very volatile, which means, I get worked up very quickly.
Yeah.
And when I do get worked up,
Yeah.
it takes me a long time to sort of calm down and back into a steady state. But then, a lot of these things, you kind of put yourself into that role as well. You start acting
Yeah.
what's been said about you or written about you or talked about you. You sort of get into that persona as well. So there is a risk of that.
Mm.
And sometimes you start doing it. It's like, yeah, I'm volatile anyways. Let me get more volatile. But it's that sense of being like good and relaxed. I think that's important. So if something really
Yeah.
relaxes you,
Yeah.
I think that's good. The problem is when it doesn't relax other people, and it causes chaos for other people.
Like playing the drums or something,
Yeah, I mean, how does that work? You want to play the drums,
Yeah.
you got thin walls, and your neighbors are arses. I
Yeah.
mean, how does that work? How
I've
how are
never
we
known,
supposed to?
actually.
Oh,
I've never known. I have actually wondered that before, because the reason I bring that up is because we lived once many years ago, and the neighbours did play drums, and you could tell they were very good, and it was there was a definite hobby of theirs, and but yeah, it drove the neighbourhood nuts, every day for a couple of hours, and it's like, what do you do? What do you say to them? Stop playing your musical instrument or the.
Well, you've got to have that dialogue, isn't it?
It's
Just
hard.
about have that discussion.
Yeah, it's really
Someone
hard.
has to be brave and go over to there and say, look, we understand that, this is your way of relieving stress, but it's really, really fucking us up.
Yeah,
And, just sort of be honest and
yeah.
upset them, basically, because they're upsetting you.
Yes, I guess it goes. Yeah, as we were saying earlier, it's okay to be offended, but not to offend, almost, and all that.
No,
So
no, you've got to
yeah,
tell people, look, I can't do this, or this is difficult. And,
yeah,
what I like about your podcast is that you're having those discussions, and they're not easy discussions to have,
mm,
but you've got to have them.
yeah, yeah.
And, you will upset a lot of people.
Oh yeah, yeah,
People will not agree with you and whatever,
yeah,
but you just got to have those discussions. And I think having those difficult discussions is really, really important, just to allow you to go through your thinking, because you have all these different conflicting thought processes inside of you. You have to get them out.
yeah. It's no, it is important to get them out, and I think if I think felt if I didn't get this message out, even if it just helps, just changes the mind of, say, like the anti-vax thing, for example, if it just makes 5 people more, five
Yeah.
more parents go, do you know what? No, this actually makes a lot of sense. I am going to vaccinate my child,
Mm.
and that to me is job done in a way.
Yeah.
It's just helping one person, 2 people. It doesn't matter how many, even if it's just a positive thing that for a couple of people. I'm actually quite happy
So
with that.
what's frustrating you now in terms of you being a doctor in the NHS right now? What are your 3 big bugbears that is not being talked about enough?
That's I would. I'm very lucky at the moment in that I'm working in a nice environment.
Mm.
I would say from previous experience, three big bugbears, and actually things that still do bother me. Actually, I would say number one is the blame culture that we have, and what I mean by that is for people that don't work within the NHS or within this type of system, we have these things like incident forms, for example, where if something doesn't go quite right into or we perceive something to be a near miss, and that phrase is thrown around very, very loosely. It could be something as simple as someone not answering the phone, and this, that, and the other, and you get put an incident form in, and if you're named on it, the bureaucracy that has to go. That goes along with that is huge, and the impact it can have on someone's career when the person putting in that instant form has really got no idea, and it's almost out of ignorance actually that they put these things in just to almost show that they've done something, and using it as a weapon. I think I actually put a tweet out the other day on the back of an anaesthetist who killed themselves, who was under GMC investigation. An old consultant of mine tweeted this article, and I retweeted it and said, using the GMC as a weapon, which it's constantly been doing, even when I was at med school. This is one of the most detrimental things that's happened in modern day medicine. I think it's awful, and I've been on the receiving end of being named as, even if I had nothing to do with a situation, but because I had seen a patient, I was one of the many who has seen this patient in that 2-week period. I had to write reports. I had to do, get called up to, and explain that I actually had nothing to do with this. All I did was say hello and, take blood or something, something small or whatever it was at the time. And you then have to declare these things on your yearly reviews, and it's the stress involved in something so ridiculous is is huge, and I think that that's my biggest bugbear, as it were. And I think ultimately what that makes that it stifles innovation.
Yeah.
And I think it, people might be thinking that that sounds weird, but we back in not even that long ago, we were prepared to take risks, be it in an operating theatre, be it in a thing, and not dangerous risks, but risks like, there's this hasn't worked. Oh, do you know what? This might. Let's try that. And whereas now you can't do that for fear of being reprimanded. And if something went wrong, you don't get the thank you for trying. At least you tried. You'll get the why on earth did you do that? That's not protocol. And that's not how you get pioneers. That's not how you create new things. That's not how you create new medicines, new treatments, and new techniques. I mean, even looking at the laryngeal mask, which is the airway that we use in a huge number of anesthetic cases to keep people breathing when they're asleep. That was created by an anaesthetist during his on calls on night shifts, for example, and he was using rubber molds and trying them out, and trying them out on testing them himself on patients, and then eventually found a shape that worked, and it's revolutionized anesthetic care, really. And so that wouldn't
Is that
happen.
because we've become weak as a profession, that we just roll over and die? Do we need to be much stronger and just stand up for ourselves?
I think we have
Say, no,
become.
I stand in front of the panel and say, no, look, this is ridiculous. I did da.
Yeah, I
That
think.
way you won't get much more bullying. You do have to stand up for yourself a lot more.
Yeah, I think we are definitely weak, but equally at the same time, I think part of the problem is you're now you no longer talk to humans. You talk to robots. In that sense, so you get pulled up by a panel of people, and you're trying to explain something from a human perspective and be like, yeah, this is common sense. This is what I did. Okay, it didn't work, or yeah, the reason why that was perceived as being an incident, as it were, is because of it. And they're like, well, no, protocol says this, and this. Our guidelines suggest this, and this. You're suspended, or yeah, or whatever it is. It's almost like it's like you're talking against a wall. The outcome is decided for you. It seems, before you, once you've gone down that path, and that's why people aren't prepared to go down that path anymore, and it's very sad. I'd say that's my biggest bugbear.
I mean, there is a movement to change the blame culture.
Yeah.
Um, uh, I think
Mm.
it's called um, Learn, Not Blame. I think that's the name of the movement. I don't know if you've
Mm.
heard of it.
I have, yeah,
Yeah,
I have heard about, I have heard about
since the
this, but
Bowel Garber case. Yeah.
yeah, I have heard about that, and since that, and yeah, I mean I think there's probably a lot
But not enough people support it. I mean, that's the problem. Not
it's
enough of us support it.
yeah, it's difficult.
I am self-critical, and I blame myself for not supporting it enough.
Yeah,
And we keep talking about this all the time. We do blame the leadership about this.
yeah, I think
We can't get away from that.
no,
I mean, in our organization, when things do go wrong,
mm,
I'm the one that's responsible
yeah,
because I'm in that leadership position, and I can't get away from that,
yeah,
whether
yeah,
I like it or not. If a person's not performing, if a person's having difficulty,
mm,
I'm just not pulling my socks up,
yeah,
and I'm not doing the job that they brought me in to do. And that's just the reality of things.
yeah.
I can't blame that person. I can't blame the system. I need to look within myself and think, shit, what am I fucking up here?
Well, I think
Why? why haven't I done this? And whenever I reflect back, there's always something that I've done that just has sort of tipped the balance and
Yeah.
made them go into free fall.
Yeah.
And it's harsh, and it's not easy because we all have massive egos, particularly doctors, because we have to have massive egos to get into medical school and get through training and get through all the exams.
Mm.
But you do have to swallow it.
It's difficult, and I think part of the problem actually with the leadership thing that I've noticed over the years is it's not so much who is the best leader for this job. That's not actually what's happening, and they're then getting that position based on their skill set and how good they are as a leader. What's happening is it's almost become who wants to do this job. Yeah, we've had so and so wants to do it. Have they had any experience? No, they were, a previous doctor or a nurse or something, and then all of a sudden they've gone from that to that with nothing in the interim, and it's because no one else wanted to do that job, and that doesn't make them the correct person to do it. Unfortunately, it's just needs must almost, and so it impacts from that level going down, and I think that's a big problem actually within healthcare. It's making sure that the right people are leading and aren't just there by de facto almost.
Yeah, yeah. Which is why getting them young is really important. To
Yeah,
talk about leadership and to talk about human interaction and to talk about these soft skills. I
yeah.
think that's
I think you're
that's
right.
essential,
And
and having these difficult discussions
yeah,
and not letting the robots win.
yeah, and yeah,
Because
absolutely.
it's easy to be a robot.
Yeah,
It really is.
I think I would say that goes on to my the second biggest bugbear, which is the sheer amount of bureaucracy involved in just doing simple things. That the paperwork involved. You speak to any junior doctor, especially a foundation year doctor who spend their life on the ward. I think I've yet to meet one who hasn't told me that one of the biggest problems they face is the sheer volume of paperwork. And I mean, there are cases whereby the paperwork takes longer than the actual procedure, and this is something that we really need to move away from. It's very difficult to do because I understand the need for it in some ways, but
Yeah.
there's got to be a better way, a streamlined way. I don't know what that is, but all I can say is I'm sure it wasn't like that 40 years ago, 50 years ago, and
Mm,
they did all right, and
mm,
so a telling case would be when I'm doing obstetrics, for example, anesthetic obstetrics, doing C-section off C-section, you do 3 or 4 in the morning or whatever, and one of my good friends, he practiced he trained in India, and he'd say to me, "Oh, Paul, we would do 20 C-sections by now," and I'd say to him, I said, "But how? I mean, it takes this long just to do all this charts and the prescription, all the paperwork." And he just looked at me like, "Paperwork, Paul," and
yeah.
it's like that was not the priority. The priority was to do as many C-sections as possible and get and make sure that everyone's healthy and well. And yes, that is obviously a priority for us too, but it seems to be the constraining thing. The time restriction thing seems to be the sort of the bureaucracy side of things rather than the actual willingness to do it. And
I mean,
it's
this is where
hard.
innovation comes in.
Yeah,
Innovation and allowing people to fail and learning from that failure so that we can make
yeah,
the system better.
yes,
And taking away that blame culture
yeah,
and allowing us to sort of find new ways of not having to spend 80% of our time on paperwork.
yeah. And I'd say my final biggest bugbear, and this one is probably the most controversial. And my biggest bugbear is I feel that there is an element of deprofessionalizing within the NHS, and I'll explain by that is, again, on the back of political correctness and all the rest, we have this idea that everyone must be on the same. Everyone's voice must be on the same level, and I understand that, and I think bullying and this, that, and the other in the NHS is awful and should be abolished. I'm not talking about that. I'm talking about the things like taking away white coats, for example, and people going, oh, it's a health risk, it's an infection risk. It's like there's no evidence for that. Actually, we practice evidence-based medicine for everything else, but there's no evidence for that. Not wearing ties and taking your watch off, covering, and it's making you less of the, it's taking away that seniority from you. So a doctor is the only person in the hospital that doesn't have a uniform. When you think about it, the porters have a uniform. They wear shirt and tie some places. The physios have a uniform. Nurses have a uniform. The receptionists have uniforms. They have the stripy tops on or the flowery top, and then they all wear the same top. Whereas doctors nowadays, we look like a mess, sometimes. and I disagree with this. I really do. I think we should have a white coat and this, that, and that's not for status. It's not about that. I think we have a right to be professional, to look professional, and we owe that to our patients. And I sometimes I wear a shirt and tie when I go into work. I change into scrubs and what have you, but and I don't need to, and it's often met with quite a lot of teasing, but in a nice way. But I think it's important, and I think, like I say, we owe it to our patients to look like we know what we're doing, to act professional, and I think it also helps that rapport. And in the same way that if you're in trouble and you're on in the road, in the street, and you see two police officers, and one is in uniform and one is undercover wearing normal clothes, you would gravitate towards the one in uniform, because it's a position of someone who looks like they know what they're doing, looks professional, and you're more inclined to divulge information to that person than someone who is dressed like they're going to the local shop. And that's not to say that that person's not a good police officer or a good doctor,
Sure.
but it's the perspective, it's the perception that we have. And so I think this idea of stripping away the uniform and doing this, I just think there's a load of political correctness rubbish.
Where's that agenda come from? This deep.
It's purely anecdotal from my side. Sorry, do you mean? I think it's just. I think it goes along the lines of we've got to abolish hierarchy. Yeah, we've got to abolish the. It's this. It's like, no. You look at all successful things. Let's take the military, for example. The military runs on a hierarchy system. The private who's just started is not going to have the same. His opinion or her opinion cannot have the same clout as the sergeant, because people will die. It's very simple, and the NHS is the same. And this idea of trying to abolish that and making everyone on the same level, no, it doesn't work like that. All that ends up happening.
I didn't know that was happening, actually.
That's how I feel. I'm like I say, it's probably the most controversial part point that I've made, and I'm sure I might get a lot of criticism for that. And like I say, I'm
Oh,
not,
I'm sure you won't. I'm sure you won't.
but I'm not in any way implying that we should treat people like crap, and I make the cleaners tea and coffee when I can. It's not about that. It's about actually having someone at the top with responsibility and that filtering down, and actually acknowledging your position in the hierarchy. I cannot have the same clout and strength in the workplace as my consultant, because I'm not
Yeah.
a consultant yet. That's what they're there for. That's why they've done that training, and that's why they are in that position, because they have that experience. And so if they tell me something, or they say something in the theatre complex, I'm not going to override that, and I should not have that right to override that. I should have the right to question it if I think it's ridiculous, of course.
Yeah, sure. Yeah.
But it's not. That's not what's happening. What's happening is your ability to send for a patient, or to get an operation going underway. It's not based on whether the consultants or the surgeons or the anaesthetists are happy to do it. It's based on it's based on a bed manager who's never seen the patient before, or it's based on other members of staff saying, no, we can't, we've got to wait for handover, or this and no, that's not how this should work. That wouldn't happen in the military. You imagine that,
Yeah.
and that's the most that's the biggest example I can give, and that's when you
And it's
talk
quite
about war.
interesting that sort of artificial intelligence is going to come in, and digitalization of the healthcare is going to come in. So do we listen to the app and the algorithm and the robot, rather than the human being with experience and intuition and let's say metaphysical insight?
Apps is an interesting one. I mean, I use apps quite a lot, and it does actually scare me. There's sometimes where I'm thinking, I knew this like before, and now I'm relying on this app to remember something trivial.
Yeah.
There is that
Like
danger.
getting to workplaces, like, well, I know the route,
Yeah,
but I do it anyway, and I'm thinking,
yeah,
yeah,
yeah. Do you know? It's very right, because I was actually thinking this the other day. I had Waze on, and I was thinking, I don't know why I've got Waze on, because I know this journey. I do it every day, and
and it's
I
more enjoyable when
yeah, I
you can
know.
do it.
It
You
is.
think, do you
It
know what?
just
I'm really
is.
enjoying seeing the traffic. Well, actually, I'm not enjoying the traffic, but do you know what I mean? It's
No, I
like I'm
know.
looking
I
at
know.
stuff. I'm not looking at my mobile anymore. I'm not doing this. I'm not
Yeah,
doing that.
yeah,
And the risk is, I hope it doesn't happen, is that we're in hospital and people don't look at the human nurse or the human doctor. They're looking at the machine.
yeah,
Okay, what does the machine say now? The machine says give them 70 milligrams of lidocaine, but you think to yourself, well,
yeah,
no, let's listen to the
yeah.
doctor here.
Yeah, absolutely. And there's been definitely a few times where I look at some of the sort of algorithm things. I'm thinking, yeah, that's not going to work for this patient.
I mean, for me,
you know.
for me, we use technology to look at the neuro retinal nerve fiber layer, thickness of that, of the optic nerve, to ascertain whether they have glaucoma or not.
Sure.
And you look at the algorithm, and it says it's outside normal limits and it's bad. Obviously, the patient sees that. The technician sees it, and the technician tells the patient, you've got glaucoma, because
Yeah.
they've looked at the algorithm.
Yeah. Yeah.
And then they come and see me, and they're all stressed and
Yes.
pissed off.
Yeah.
And then I look at the nerve, and I know that's not glaucoma
Yeah.
from my experience. How do you fucking convince the patient that they don't have glaucoma?
It's really
And they say,
hard.
well,
Yeah.
but doctor, the scan says it's outside normal limits. Even they don't say technician, they think they're a doctor.
Yes.
Oh yes, but the doctor before you said I've got glaucoma. So you spend like instead of spending 10 seconds saying you're fine, Mr. Jones, off you go.
Yeah.
You spend like half an hour trying to tell
Trying to
them
convince them nothing's wrong. It's true. It's like it's
gonna get worse, mate.
I
think,
know. It's like especially
we've got
now with
someone,
Apple Watches and stuff.
someone who's designed an app and convinced the NHS to sort of commission their work. Whereas you're very experienced doctor who's been in this game for 20, 30, 40, 50 years, and fucking hell, they're retiring early because they've had enough.
Yeah. Yes, we are seeing that now. More and more people actually saying, "Do you know what? I can't do this till I'm 70 or whatever." They want the
But that's the
retirement
case
age
in all
to be there.
sectors. I mean, I'm in the private sector, and it's exactly the same thing there. You've got people of very low seniority arguing with you about cases that they have no clue about, and you're thinking, fuck's sake, I know what I'm talking about. I've been in this game for a long time. Thank you very much. The risk is, or the problem is that once we bring apps into the equation, once we bring artificial intelligence into the equation, are we shortchanging the next generation of junior doctors and up-and-coming doctors?
It's a very good point, actually. Something I haven't really thought about, but yeah, as people are coming through the ranks now, coming through medical school and seeing them, you're thinking, yeah, actually, your entire thing is algorithm based or protocol based, and I think that's another sort of little bugbear. We seem to be sort of being driven into being robotic almost, in terms of our the way we treat people. Oh, you've come in with chest pain, this, and this. You've come in with this, and so on. And it's almost like, I think that's what the government was trying to achieve with the 111 helpline, the NHS helpline thing, and it doesn't quite work like that. You can't. Not everything can be a protocol or a guideline or this and the other. You sometimes just have to use the common sense that has been instilled into you, bestowed upon you, and use the intellect, use the experience, and use your colleagues and your knowledge just to create an overall picture of a patient and treat them accordingly and appropriately.
And that comes back to trust.
Yeah.
I think you either trust yourself,
Yeah.
or you trust the algorithm or the system.
Yeah.
And this goes back to sort of self-trust and self-love and self-understanding.
Yes.
And, I'm a real fan of that. The more you know yourself, your areas that you totally excel in, and the areas that you've got shortcomings in.
Yeah.
That's the only way we're going to find ourselves. We can chat for hours and hours, and I'm sure the listeners can listen to us for hours and hours and hours. And I was on your podcast, and it was really, really awesome because I was allowed to be myself. And I can get a bit crazy sometimes.
Have moments.
Yeah, I have my moments. And we're allowed to have our moments.
Of course.
Don't worry, I'll be punching anyone any time. So yeah, how can people get hold of you and your podcast and tell us more?
Sure. So my podcast is called A Doctor's View, and it's on iTunes. You put A Doctor's View into there, and it should come up. Hopefully, still comes up. It's also on Spotify and pretty much all the major podcasting platforms out there. And also, I've got a website, adoctorsview.uk. And you can email me as well, doctorsview@gmail.com. And always, I'm happy to answer any questions that anyone has in terms of if there's a topic that people want me to discuss. I'll research into it, and I'll happily talk about that. Yeah, and I'm on Twitter as @Dr. Polyvios, and so that's my name on there. But yeah, it's been a good fun time doing it. So,
Good man.
yeah.
Thank you, Paul.
Welcome. Thank you, Haidar.
Thanks for listening to this installment of the Surgical Spirit podcast. For all the latest in the world of surgical spirit, don't forget to follow on Twitter at The Third Eye Doc and catch me on Facebook at the page The Third Eye Doctor. You can visit the website at www.thethirdeeyedoctor.co.uk for more information on the work that I do. And please send us feedback and questions and suggestions for the podcast. It's always a pleasure to hear from you. I've been Dr. Haidar Al-Hakim, and I'll see you next time.